Hi everyone, my name is Rishikesh Joshi and I'm a fourth year medical student at the University of California, San Diego. Thank you for taking the time to read our chapter in Newman and Wynn's Neurological Surgery 8th edition and for viewing the accompanying video titled The Use of Predictive Machine Learning Models at the Population Level Has the Potential to Save Costs by Directing Economic Resources to Those Likely to Improve Most, a simulation analysis stratified by risk in the largest combined U.S. and European adult spinal deformity registry. This work was conducted under the supervision of Dr. Christopher Ames and in collaboration with the International Spine Study Group and the European Spine Study Group. I have no disclosures for this talk. Recently, the demand for value-based healthcare has garnered significant interest due to ballooning healthcare costs and progressive budget constraints. For example, in the U.S. alone, healthcare spending is projected to grow faster than the economy over the next decade. Adult spinal deformity corrective surgery presents a unique problem in this context due to its costly nature and high complication rates, which often result in hospital readmissions and reoperations. These adverse outcomes can cause increasing financial burden on both patients and the health system itself. As can be seen in the two tables in the bottom right corner, rates of spinal deformity surgery have continued to steadily increase, both in terms of sheer number as well as rate per 100,000 in the population. To try and answer these questions, robust predictive models have been used and offer the potential to identify high-risk and high-cost patients, as well as those likely to benefit most from surgery prior to incurring their costs. In our study, we wanted to validate the use of predictive machine learning algorithms for conducting public health studies at the population level. In essence, we wanted to see if we could simulate surgical candidate selection during the preoperative evaluation phase, in which case we would not yet incur the healthcare costs associated with their care. For our study cohort, we used a prospectively collected database of ASD patients with 2-year follow-up gathered from 17 different ASD specialty centers across the US and Europe. This comprised a total data set of 1,245 patients. The predictive models used in the study have previously been published in both JNS Spine and Spine Deformity. These models have been validated for predicting health-related quality of life outcomes such as minimum clinically important difference, or MCID, as well as adverse outcomes such as major complications, readmissions, and reoperation. For our study, we used a model that utilized gradient boosting classification and predicted MCID, major complication, and reoperation rates for our patients. This table shows the results of our predictive model and encapsulates our simulation study for 3 specific outcomes: MCID rate, complication rate, and reoperation rate. Each of these outcomes are depicted in 10% increments to highlight how different threshold criteria corresponds to selection of a different subset of patients. The importance of this is to understand how, as MCID rate increases, for example, this corresponds to a decreasing subset of patients who are predicted to meet that criteria and subsequently shows a significant cost reduction in millions of dollars. In our study, we were interested in combining several of these thresholds, as shown in the bottom left quadrant, where MCID and complication rate thresholds are combined to identify patients who would meet both of those criteria. The scatter plot shown here visualizes the predicted outcomes for the patients in our dataset. On the y-axis, we have predicted MCID rate, and on the x-axis, predicted complication rate. Each point on the scatter plot represents one patient with their corresponding MCID and complication rate profiles. For the purpose of this simulation study, we sought to use as an example the subset of patients with greater than a 50% chance of MCID improvement and a complication rate less than 20%. Patients meeting this criteria are highlighted in the red box. This corresponded to 33% of the overall dataset. We then extrapolated this percentage to real-world populations. Looking at data from the United States in 2013 for ASD surgery, this would have corresponded to a reduction from 6,700 operations to around 2,200. This overall reduction would have saved the hospital systems $541 million in cost savings. When looking at data from Spain in the year 2015, we saw that this would have resulted in a reduction from 740 adult spinal deformity surgeries to 244, or a rate reduction of 1.64 to 0.54 per 100,000 in the population. In conclusion, we have shown that predictive models can serve as valuable tools that provide insight into how patients may respond to ASD surgery during the preoperative evaluation. This will be increasingly useful moving forward, as this novel data can augment surgeon and patient decision-making. We have also shown that machine learning models can effectively be used to simulate subpopulations by predicting outcomes and then determining which patients meet specific outcomes criteria. This subset analysis can be applied to population-level data to better understand the downstream economic impact. In essence, we have also shown that we can optimize candidate selection using these machine learning models to identify patients most likely to benefit from surgery, while also reducing the societal economic burden from surgeries predicted to yield little clinical benefit and that are predicted to have high complication rates. I would like to thank my mentors, Dr. Daryl Lau, and in particular Dr. Christopher Ames, for supervising the study and for giving me the opportunity to conduct this research. In addition, I would like to thank my mentors abroad, Dr. Miguel Serra Buriel and Dr. Pelisse, for their supervision and mentorship as well. And lastly, I'd like to thank the European Spine Study Group and the International Spine Study Group for their collaboration. Thank you for taking the time to watch this video, and please feel free to reach out with any additional questions. Thank you.